Hello and welcome. My name is J. Michael Bennett. I am an orthopedic sports medicine surgeon. I specialize in injuries of the shoulders, elbows, and knees. Today we're going to be focusing on the elbow. The elbow is a multi-axial joint that has multiple planes of motion. When you bend your elbow, this is called flexion and extension, and you can see the model here. This is flexion and this is an extension. We have supination, which is the palm up, and then we have pronation, which is palm down. As you can see, primary movements of the elbow are flexion, extension, supination, and pronation. There are a number of ligaments and tendons around the elbow, and these ligaments and tendons can commonly be injured, particularly with any kind of repetitive motion. First and foremost, we have a common injury and ailment called golfer's elbow, which actually occurs in the medial aspect of the elbow, which is the inner side of the elbow. This controls the flexion of the wrist. There's a number of muscles and tendon units that insert right here on this bone, which is called the medial epicondyle. With repetitive motion, particularly repetitive flexion, and you can actually get this from other sports aside from golfing, will irritate this group of tendons, or this main tendon here at this insertion site. What happens at that point, you get these micro tears. That tendon may actually split into small fibers and actually may develop some small tears that can get easily inflamed and irritated and fill in with degenerative tissue. That tissue can become easily irritated and become very painful, and it becomes painful when you try to elicit that activity, particularly when you're swinging a golf club or when you're lifting a weight. This is easily treatable about 95% of the time with doing things like proper exercising, modification activities, rest, anti-inflammatories, bracing, and occasionally an injection. Appropriate bracing is called a Counterforce Brace. It actually goes around the forearm and unloads this tendon. Using that for a period of a couple of weeks will actually unload the tendon and allow it enough time to heal. Now occasionally, about 5% of the time, these injuries may not get better. And if that's the case, your physician or surgeon needs to get an MRI to actually look at this tendon to see if it is degenerative or not, or how badly torn it is. And occasionally you can have to, and occasionally surgery is indicated, where we actually go in there and debride and repair that tendon. Now on the other side of the elbow, the lateral side is over here, and the outside of the elbow, and this is where the common extensors insert, and that allows you to lift your wrist up. And this is where patients will commonly get what's called lateral epicondylitis, also known as tennis elbow. It was originally described by tennis players because of the type of grips that they would use in holding a racket, and it would overload this area. Same exact thing happens with the lateral side as the medial side. The tendon becomes overloaded, these micro tears occur, you get degeneration within that tendon, and this can lead to chronic pain. Once again, you can treat this with bracing, exercise, modification activities, occasionally anti-inflammatories and injection, and if it does not respond, then we tend to obtain an MRI, and very seldomly we need to operate. With fixing the lateral side, we can do the surgery in one of two ways. We can do it arthroscopically with two poke holes on either side of the elbow. We put a camera in there and actually debride this area and repair it, or we can make a small incision about 1.5 centimeters or 2 centimeters big over the site and repair it with an anchor. Same thing with the medial side. So those are the two common injuries of the elbow on the lateral and medial aspect of the elbow: medial epicondylitis and lateral epicondylitis, also known as golfer's elbow and tennis elbow.